Well, hello. I'm going to talk about the disease cholera, which is caused by an agent of biological type called Vibrio cholerae. This is an aerobic bacillus that is transmitted through fecal matter. It is contracted by consuming food or drinking water contaminated by the fecal matter of an infected person. There are many serogroups of Vibrio cholerae, but only two, the 01 and 0139, cause outbreaks, and 01 has been the cause of all the recent outbreaks. Talking about the disease itself, we have two main stages, subclinical and clinical. The subclinical is when the patient hasn't developed symptoms. And well, we have here the incubation period that fluctuates between 2 hours and 5 days, and the tissue changes. That when it is when overcoming the acid barrier of the stomach, the bacteria colonizes the epithelium of the small intestine, mainly through a core-regulated pilus, and this causes these levels of CAMP, cyclic adenosine monophosphate, to increase thanks to an enzyme released by the bacteria, and this changes the absorption tendency of the small intestine by secretion. Now we have the clinical phase, which has the prodromal period, that is when non-specific symptoms appear, like sudden watery diarrhea, throw up, and dehydration and its effects, and the clinical period, there are specific symptoms that appear, like diarrhea with whitish color and frequent vomiting, and when we have here complications that could be shock, severe dehydration, and kidney failure. On prevention, we have the primary, that is always drink boiled water and wash and disinfect fruits. Secondary, we have to take stool samples in patients suspected of cholera to isolate them. And tertiary, we have that it is recommended to have a correct hydration and rest until the patient feels better. And here's the bibliography.